A medical clinic in the Amazon rainforest may not be the first place you'd expect to see physicians and students from Northwestern University Feinberg School of Medicine. But thanks to professors who started a remote clinic in Bolivia 10 years ago, adventurous students are helping bring much-needed healthcare to this impoverished area. In the decades since this remote medical clinic was founded in Bolivia's Amazon basin, tens of thousands have made their way down this long dirt road to receive life-improving, sometimes life-saving medical treatments. The Centro Médico Humberto Parra was founded in 2001 by 3 doctors, including Dr. Mark Molich, professor of medicine at Northwestern University's Feinberg School of Medicine. Molich started the clinic with his wife, Dr. Susan Ho, a professor of medicine at Loyola University, and Dr. Douglas Villarroel of Bolivia. Their goal was to make regular healthcare a reality for the impoverished people who live in the rural villages surrounding the clinic, 2 hours outside the city of Santa Cruz. The clinic has treated more than 30,000 patients.
We progressed now to the point where we were able to stock a pharmacy with medications. We're able to develop a laboratory that can do the routine chemistries and blood counts and things that many laboratories can do. We've clearly come a long way.
The clinic has ophthalmology and dental suites and modern exam rooms where patients are treated for ailments as varied as cancer, heart disease, diabetes, AIDS, snake bites, and mosquito-borne diseases.
There's some diseases that they don't see in the United States that they become aware of.
Funded by private donations, the clinic relies largely on volunteer doctors and other healthcare professionals. For the medical students at Northwestern University's Feinberg School of Medicine, medical residents at Northwestern Memorial Hospital, and students and residents from other institutions who travel to Bolivia to work there, volunteering at the clinic offers unique learning opportunities.
It's something that is really amazing that Northwestern has and that the Global Health Initiative has provided for us. I mean, the clinic here, for example, is something that really wouldn't run without students and without residents from the U.S.
The clinic, even in the way it treats its patients, is a very warm environment and very personalized connection with its patients as well, which is really refreshing because sometimes you hear about doctors not really caring about their patients, so it was nice to see that warm family style of healthcare.
Northwestern gains the ability to have students and then residents in the house staff training program be able to go down to Bolivia and get an exposure to underprivileged people who are in a totally different culture, and they just never would have had an experience like that.
Why would she be getting recurrent similar thing?
So we just had a 46-year-old lady with a history of several neck abscesses which have occurred within the last 2 years or so. We were able to take care of the abscess, do the incision and drainage, get the sample for culture, and follow up with her next week, all for no cost to her.
The clinic's visiting doctors and students rely heavily on their physical diagnosis skills.
They don't automatically get, say, an echocardiogram. They actually have to listen to the heart and examine the patient like what was done years ago.
Several first-year medical students visit the clinic each year. They work there with 4 to 8 fourth-year students and 6 to 10 medical residents. Each person who travels to the clinic carries a bag full of supplies that come directly from the basement of the suburban Chicago home the couple shares.
So let's send down a few boxes of gloves as well.
One of the earliest lessons visitors learn is about healthcare accessibility, or the lack of it. Armed with the knowledge that Bolivia is a poor country where very few can afford medical treatments, first-time volunteers are still caught by surprise.
Transportation itself was an issue, so that was amazing to me because I had never even thought about how even a paved road makes such a difference. We saw days where it would rain really terribly, and sometimes the roads would be shut down to the clinic, and that just rain being a barrier to receiving health care is something you don't really see in the States, at least.
Ansa Wong and AHLZADEH spent 7 weeks in Bolivia with fellow Feinberg student Danielle CHUN, conducting a study on diabetes and promoting healthcare awareness for 500 residents of 4 villages near the clinic.
Just making that personal connection and being able to really make a comfortable environment between you and the patient is probably the most important thing about being a great doctor.
I think it made me realize that I definitely want some of that hands-on patient interaction for sure.
The Centro Médico Humberto Pará, providing medical students and residents with hands-on experience and lessons on the vital diagnostic skill of listening, while providing care for those who desperately need it. A mission accomplished, even as the work there continues.